Today we're going to go ahead and talk about cell-based therapies for knee problem. Some of the basic knee problems that you may run across include arthritis and tendinitis, breaks in your bones, cartilage injury, and maybe even some infections. Well, cell-based therapies can help with that whole range. They're not a cure, but they help the body heal itself. And you may be asking, well, how does this work? And on our website, we have a description of how this works and a step-by-step process. But is there evidence that it works? And yes, there is. First of all, we have to talk about safety because we don't want to give anything to a patient or provide anything to a patient if it's not safe. So there's been two major studies looking at bone marrow and the safety of it. The first one was actually called the Safe Cell study that was done in Canada. And it looked at over 1,000 patients that they followed, and their conclusion was that this was safe. And then Philippe Hernigo looked at over another 1,000 patients, about 1,873 patients that he followed for an average of 12 and a half years, and he looked at 7,000 MRIs and 54,000 x-rays, and they found no incidence of tumor formation or cancer. And in fact, the patients that received the stem cell process actually had a lower rate of cancer, although this does not prevent cancer. But then looking at for arthritis of the knee, one of the most common conditions of the knee, is this helpful? And is it better than a lot of the common treatments that we use? So first of all, there was a study comparing stem cells that were injected into a knee to a common treatment called hyaluronic acid, sometimes known as chicken fat, rooster injections, gel injections, and that's usually a series of 3 to 5 injections given 1 week apart. And what they found out was that the stem cell group did better in a side-by-side comparison, and they actually even had positive changes on their MRI. And the reference for this is also on our website. Then we kind of look at some other treatments that we use. A common one, if we just go in and do an arthroscopy to the knee, where we go in with a little tiny TV camera and remove damaged tissue, like a torn meniscus. Well, they looked at that again, and they split them up in 2 groups. Group A went ahead and just had the arthroscopy. And Group B had their arthroscopy, but they delivered stem cells at the end of the procedure. And when they followed them out, again with MRIs, the Group B that received the scope plus the stem cells did better. And then we kind of move into the other surgical realms, such as what's called a high tibial osteotomy, where they would cut the bone. So if your knee joint is bent, we're going to try to make it straight by cutting the bone and making it straight. And when they went ahead and just cut the bone and made it straight, and then they took another group and they cut the bone, made it straight, but then they added stem cells to it. Again, the group that had the stem cells did much better all around. Less complication rates, less pain, quicker recovery. And also there was the first procedure that actually used cells in knee injuries was an autologous chondrocyte implant, or ACI. And that's where we took a little sample of your cartilage, we would send it off to a place in Boston, it would grow the cells, we'd have you come back, open up your knee, make a little pouch made of actually the tissue right next to your own bone. We would make a pouch out of that and put that into your knee and then put the cells in. And that was a big step in this direction of trying to regrow cartilage. Well, if we take that procedure and we compare it to just injecting your knee with stem cells, what group would do better? Well, in that study, we also found out that the stem cell group with just a simple single injection did better than the staged procedure of the ACI. And then finally, we had to look at our gold standard, which is joint replacement. And joint replacement is a great procedure for most patients. where this is a procedure where we remove the damaged cartilage, we make your knee straight, we balance your knee out, and it's got a very long track record. It's been used well over 40 years, we're actually approaching over 50 years now. And from there, we can show that about 90% of the patients get better. That doesn't mean all 90% of them have excellent results. It just means that 90% get better. And if we even look out 30 years from now, over 80% of those patients will still have that knee replacement in. So it's a good, reliable procedure. But is it better than stem cell procedures? So again, Philippe Hernigot, University of Paris, looked at two different groups. Older groups, patients that were in their 80s, and younger groups, patients that were in their late 20s and 30s. And they replaced one knee, and then the other knee they did stem cell procedure, very similar to the procedure that we do right here. And then they followed them out. In the younger patients, with the average age of 28, they went ahead and followed them out for 12 years. And they found out that, again, the stem cell side did better. And what was very interesting in both the younger group and the older group, they asked them at the end of the study, point to the knee you like better. 7 out of 10 of them pointed to the stem cell side. There was also a lower complication rate that was associated with the stem cell side, which makes sense because it's much less invasive. And there was, again, a higher satisfaction rate. What was also interesting is that the reoperation rate was almost half. So if you had a knee replacement done, your chance of needing another surgery was higher than if you just had the stem cell procedure done. And again, just about 10% of the patients failed the stem cell procedure and had to have a knee replacement done. But when they did have the knee replacement done, their rate of complication after that procedure was almost half of the index procedure, the first knee replacement done. So overall, we can show that cell-based therapies are safe and they're also effective. But that just doesn't mean that it's for everybody. Not every treatment is for every person, and you have to fit certain criteria that would allow you to have a good outcome. And that's something that we would do here, where we would evaluate you to make sure that this is the right procedure for the right person in the right situation. So these are your cells for your healing.